Generalized anxiety disorder. The best treatment options. Anxiety disorders are the most common category of psychiatric diagnoses. The most common anxiety disorders are specific phobias. Besides generalized anxiety disorder, other anxiety disorders include separation anxiety, selective mutism, social anxiety disorder, social phobia, panic disorder, and agoraphobia. Anxiety disorders can also be caused by some medical conditions, medications, or substances. Signs and symptoms of anxiety may be physical, emotional, behavioral, and cognitive. Many of these signs and symptoms are similar to the body's normal fight or flight response to danger. Children and adolescents may have symptoms of anxiety either similar to or quite different from those of adults, depending on the specific diagnosis and age of the individual. There also seem to be gender-related differences in how many men and women experience and show anxiety. While obsessive-compulsive disorder used to be classified as an anxiety disorder, it is now grouped with other compulsive disorders. Post-traumatic stress disorder has been reclassified as a trauma-related disorder instead of an anxiety disorder. Generalized anxiety disorder is an anxiety disorder that is characterized by excessive worries that interfere with the person's life in some way. GAD is quite common, affecting millions of people. While there is no single cause of GAD, there are many factors that increase the risk of developing this disorder. If a medical or mental health professional suspects that you have GAD, you will likely undergo an extensive medical interview and physical examination. GAD usually requires treatment for it to resolve. Treatment of GAD usually involves some combination of lifestyle changes, psychotherapy, and/or medication. It is important for the individual with an anxiety disorder to work closely with their prescribing doctor to decide whether treatment with medications is an appropriate intervention, and if so, which medication should be administered. Various lifestyle choices and family interventions can also help prevent and decrease anxiety. There are many support groups and resources for people who suffer from generalized anxiety disorder, GAD. Types of anxiety disorders. Anxiety disorders are differentiated based on the type of object or situation that causes fear, anxiety, or avoidance, as well as the thought patterns associated with the fear or anxiety. To be considered an anxiety disorder, the fear or anxiety also has to be persistent, and not a normal developmental phase. Anxiety disorders commonly start in childhood but persist into adulthood. The most common anxiety disorders are specific phobias. Specific phobias are an excessive fear of a specific object or situation, such as spiders, heights, flying, or closed spaces. In social anxiety disorder, people are excessively fearful or anxious about social interactions or situations that may involve being observed or scrutinized. Generalized anxiety disorder, GAD, is characterized by persistent and excessive anxiety and worry about many different areas that are hard to control. Other anxiety disorders include separation anxiety disorder, selective mutism, agoraphobia, and panic disorder. Anxiety disorders may also be caused by drugs, medications, or other substances. Withdrawal from alcohol and certain drugs can also cause anxiety. Like symptoms. Medical conditions can also cause anxiety disorders and are anxiety-like symptoms. Anxiety symptoms and signs. Common symptoms and signs of anxiety disorder can include restlessness or feeling edgy, becoming tired easily, fatigue, trouble concentrating, that may also appear as memory or attention problems, feeling as if the mind is going blank, irritability, muscle tension, headaches, sleep problems. Anxiety that is associated with specific or social fears may also result in avoidance of certain situations or an elevation of symptoms to trigger a panic attack. Panic attacks are sudden episodes of intense fear and/or physical discomfort that reach a peak within minutes. Specific signs and symptoms of panic attack include both physical and emotional symptoms such as palpitations, chest pain, chest tightness or other discomfort, feeling like one is having a heart attack, shortness of breath or trouble breathing, sweating of the palms, nausea or other stomach upset, trembling or shaking, feeling dizzy, unsteady, lightheaded, or faint, derealization, feelings of unreality, or depersonalization, feeling detached from oneself. Many anxiety disorders first develop in childhood or adolescence. Although some may resolve, many persist into adulthood. Some anxiety symptoms are related to childhood development. For example, separation anxiety is normal in young children. However, when the fear of being away from their parent persists or interferes with normal development, separation anxiety disorder is diagnosed. Selective mutism refers to an inability to speak in social situations where there is an expectation to speak, but they are still able to speak in other settings. When this pattern persists and causes problems with school, work, or other performance, selective mutism is diagnosed. Anxiety in men and women. Anxiety disorders are diagnosed in women about twice as often as in men. It is difficult to determine if women are more susceptible to anxiety disorders, or if men are less likely to acknowledge or report symptoms, and are thus diagnosed less often. Similarly, differences in how men and women experience or recognize anxiety symptoms may also influence anxiety disorder diagnoses. Studies indicate that men seem to experience effects of anxiety differently compared to women. Specifically, men tend to exhibit more psychological symptoms of anxiety, like tension, irritability, and a sense of impending doom. In contrast, women tend to develop more physical symptoms like chest pain, palpitations, insomnia, shortness of breath, and nausea. Further, it seems that women with such physical symptoms of anxiety are more at risk for developing heart problems. Mental health diagnoses associated with generalized anxiety disorder. When people are diagnosed with GAD, they commonly have other anxiety disorders. Individuals with GAD very commonly will also have major depressive episodes during their life. Symptoms of GAD are very common in other disorders, including PTSD, panic disorder, bipolar disorder, and psychotic disorders. However, the diagnosis of GAD would not be given if the worry and anxiety are better explained by another diagnosis. Healthcare professionals diagnose generalized anxiety disorder. According to the DSM-5, the diagnosis GAD requires the following criteria, which must be present at least 6 months for more than half of the time. Excessive anxiety and worry. Worry is about a number of events or activities. The worry is difficult to control. The anxiety and worry are associated with at least 3 of the following symptoms: restlessness or feeling keyed up or on edge, easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, sleep disturbance. The anxiety, worry, and/or physical symptoms cause significant distress and or impairment. Impairment may be in social, occupational, or other important aspects of life. The anxiety and worry are not better explained by a medical condition, a substance, drug of abuse or medication. They are also not better explained by a different psychiatric diagnosis. Types of specialists treat generalized anxiety disorder. Many healthcare professionals may help determine the diagnosis and recommend treatment for individuals with GAD. These include licensed mental health therapists, family physicians, or other primary care professionals, specialists whom you see for a medical condition, emergency physicians, psychiatrists, psychologists, psychiatric nurses, and social workers. Medication treatments for anxiety. There are a variety of treatments available for controlling anxiety, including several effective anti-anxiety medications and specific forms of psychotherapy. In terms of medications, buspirone is known to be quite effective for treating GAD. However, it seems to be less effective in managing many other disorders that often co-occur with GAD.